I'll turn this over to Liz to start our discussion.
Hi, good afternoon, everyone. Just thought pop on this webinar as it's a good opportunity to reach a large number of people, both from the facilities as well as local public health. I know that there have been a lot of questions coming in related to long-term care testing, so hopefully we can get some of those addressed today. Just from a statewide perspective, several weeks ago, we began working on more targeted efforts for long-term care testing, which ended up weaving in nicely to with what the White House recommended last week for comprehensive testing for all long-term care residents and staff. So what we started doing is offering testing to all of our long-term care facilities that had any positives in the building, whether they were residents or staff. Since then, we have broadened it to if a nursing facility is interested in doing surveillance testing for their residents and staff, we will be happy to provide supplies for that. Second, we began doing what we call strike teams, and that was our first one was in Tama County. Essentially, we went into a county, we established a location, and we offered testing for all long-term care staff in that county. And we've done that, I believe, in 6 counties now. We're going to be in Cerro Gordo this week as well. And those have been state-led in those particular counties. But what we've also seen is local public health entities taking initiative and putting together their own strike teams. And we, as the state, have been providing supplies for that, while they have been doing a lot of really great work in organizing and mobilizing the resources at the local level to ensure that the facilities have access to testing. The differentiating pieces of that might be that when we do a state-led strike team, we open that testing up to all of our nursing homes in the county, as well as assisted living, residential care facilities, and ICFIDs. Local public health might open it up to all of those facilities as well. They might not, or they might also open it up to other entities like food processing plants, emergency management, frontline workers, etc. And then the fourth thing that the fourth prong of long-term care testing is we have been opening up testing opportunities for all long-term care staff in the counties where we have the Test Iowa sites. So previously, if an individual was working at a long-term care facility and they went into the Test Iowa site and took the assessment and indicated that they were a healthcare worker, that should have guaranteed them a test. However, we did add a new box within the Test Iowa assessment that actually says long-term care facility staff. If you do check that particular box, it will guarantee you the opportunity to participate in a Test Iowa test. So right now we have 8 locations across the state. Our numbers are going up quite a bit. We will continue to notify facilities in the areas where Test Iowa sites are opening up to make sure that they are aware that they have that opportunity as well. So that's really just a high-level overview of some of the efforts that we are going through to make sure that long-term care facilities have access to whatever testing supplies they might need for both their residents as well as their staff. So, Dr. Garvey, I'm not sure if you want to open it up to questions.
Yeah, that sounds great, Liz. So there's a couple on here. We'll jump to First, I know that you might need to jump off of the call a little bit early. So is the governor going to require testing of all long-term care facilities? I'm in a county that's had very little virus activity, but we're hearing that this is possibly occurring. Liz, do you want to clarify the request for testing versus the requirement?
Yeah, so at this point, it is not a requirement. It's not mandatory. It's voluntary from both the facility as well as the staff perspective. However, I think Dr. Garvey can probably talk more in depth about this, but we do see value in doing surveillance testing even in counties where there is a low positivity rate, as well as facilities that haven't had any COVID positive cases.
Yeah, that's right. So I think that just helps. We've heard from a lot of facilities that it helps them really try and understand how their residents and their staff have been impacted, and they found it very helpful. So the next question is, can we clarify the governor's statements about 95% of all nursing home residents and employees being tested? Go ahead, Liz.
Yeah, so I think that the biggest point of clarification for that is that when we have looked at facilities across the state and what we have offered from either one of those 4 prongs that I mentioned earlier, so offered testing to long-term care facilities directly, the strike teams, the local public health strike teams, and the Test Iowa offerings. When we look at all of those 4 prongs together, the comment is meant to mean that 95% of the facilities across the state have been offered testing. Now, not everybody has participated in that, and that's an important point of clarification, but we're trying to get the message out so that we do have increased participation because we do think that it's very valuable.
Sure, there's a question, and I think Liz answered it, but I'll just restate it. Can IDPH request tests for long-term care be used for residents? Should all residents be tested? So, Liz, I think you talked a little bit about how the testing can be used, and certainly, again, it's an option for all long-term care facilities, and the testing would be for the residents and staff. Anything you want to add to that, Liz?
No, I think you got that perfect.
Okay, another question about should we be offering serology and PCR testing? And so really what many facilities are doing is doing PCR testing for both staff and residents, and also doing serology testing for staff, just to give a sense of whether they have staff that have already been ill, and it helps them kind of understand potential issues with workforce needs. So that's a model that many long-term care facilities have used. So that's a good option. Liz, anything you want to add on that?
No, nothing to add.
Okay. Who is covering the costs of the test? And so the costs of the tests are being covered by the state. So there's no charge to the facilities themselves for the supplies for testing, nor for the tests to be run. Can we open this up to our jail facility? The county run testing. I think that's something we can definitely talk about internally. Liz, I don't know if you have anything to add relative to jails. I'm not sure that we've had a lot of requests for that yet. I know that some counties are doing testing within the jail, especially in counties that have seen cases. So, Liz, anything you want to add other than?
I think that that's a really great question. I think that we're going to see, well, I think that we have already seen the same type of transmission anywhere there's those close congregate living situations, so long-term care, is similar to a jail, just in the sense that a lot of people live within close proximity to each other. So Dr. Garvey's absolutely correct. We have had some counties where there has been jail testing, especially where there have been positive cases noted. Working closely with the Department of Corrections and the counties and the Department of Public Safety. I know that any time that there right now is any type of transfer, they're doing the testing prior to the transfer as well. So I think that that's a great question, and definitely something we'll be looking at more and more as time goes on.
That sounds great, Liz. The thing I would also mention is for anyone who's requesting that type of assistance with testing, please work with your county emergency manager to request that through WebEOC, and then that'll get that on our radar and we can address those requests. The next question is, we need information provided for health systems when medical directors of long-term cares refuse to take patients back once a positive test occurs. They are wanting to keep, I assume, the patient hospitalized for more than 14 days before they'll take the patient back. Liz, do you want to talk about that the protocol that we've worked on? Would you like me to touch on that?
Yeah, you go ahead.
Yeah, so there's some guidance on our website, and we've asked long-term cares to determine whether they are able to isolate patients in these types of situations. If you have remaining questions about this, we recommend you take a look at that guidance document and reach out to your field epidemiologist. In this situation, the question is from a local public health department, so we can touch base on that with you. If a long-term care wants to do testing, should they contact IDPH directly or go through their county emergency manager? Liz, I think you talked about that a little bit already. Do you want to clarify that requesting process?
I think that to the extent that you can, and Dr. Garvey, please jump in if I'm misstating anything, but to the extent that it's possible, I think it's always going to be good to work through your local public health or your local emergency management team first, or at least make them aware of the desire to do that testing. I think just from a practical perspective, in the governor's office, we really do see it as a no wrong door approach. So no matter who it's coming in through, we're going to look at that and make sure that it gets met. But we want to make sure to loop in the local entities as well, so they know exactly who's been tested, and we would appreciate just the same as well, so that we can all kind of plan moving forward and have a good sense of who has been tested and who is still outstanding.
Sounds good. Next comment is, can you clarify long-term care facilities, our ALF was not offered testing? So certainly if your facility is wanting to have testing occur, then just as Liz just mentioned, reach out to your local partners at the local health department and local emergency management level, and then they can put that request through. Certainly if you reach out to us, we'll circle back around to those local entities as well. Is there guidance on how often that we should test? That's a great question. So that really gets to the fact that this PCR testing is kind of a snapshot in time to let people know who may or may not be infected with the COVID virus. And certainly 1 day later or 2 days later, those individuals could test positive if they're incubating COVID. So again, this is one tool. What's really important for local or long-term care facilities is to make sure that you're implementing all of the recommended infection control. That's what's going to keep this virus from circulating within your community and mitigate the spread. So while testing is a great tool to give the facilities a sense of who may have been infected and help with the isolation process, it's most important to also make sure that you are have implemented fully all of the infection control recommendations. And if you are needing additional resources, we direct you to our website where we have a checklist for facilities that are having outbreaks and links to additional resources that are available through the Centers for Disease Control. And also the associations have a lot of resources available as well. A request for something in writing that explains the 4 prongs of what Liz explained. That's a great question, and that's something we can work on.
Yep.
A question about whether the testing can be extended to assisted living facilities. Do you want to touch on that, Liz?
Yeah, I think right now, from our perspective, we already have begun to extend that to assisted living facilities. So to the extent that you have an assisted living that would like to do testing, as Dr. Garvey was saying earlier, you know, just work through the same channels and we'd be happy to help.
We have a comment from someone that says they took the Test Iowa assessment already, but didn't indicate that they work at a long-term care. So they weren't offered testing. Should they change the category? Yeah, so I think certainly if it would make good sense to go back in and take that assessment again, and then you should be offered testing. If you have any trouble, there is a 800 number or a call center number that we can share as well. And that is on our webpage, on the coronavirus.iowa.gov webpage. But certainly I can try and pull that up while we're on this call as well, but they can help too. Excuse me, another question about do serology tests, are they covered, the cost of them covered? Yes, they are. So both the serology and the PCR testing costs would be covered by the state. I couldn't get. So a question about someone couldn't get the webinar to work. Can I please answer questions again? We will archive this webinar and post it, and so we invite you to watch the webinar again after it gets posted. For serology, there may be a need for a contracted lab to draw and centrifuge. Does the state cover these costs? Liz, do you want to touch base on the types of assistance or reiterate that we could provide in those situations where there would need to be some assistance with serology?
Yeah, so we have had situations where the local public health entities have been able to put together teams of medical professionals to either administer the testing at like a location where facilities come in, or to take the team out to a facility for the serology testing. The same is true related to the state strike team. So we typically don't go into facilities and rather have for staff, one location where staff come to. But we do provide the resources from a human capital perspective to do the blood draws, and then we also have the centrifuge if that's needed for the particular test that we're doing. And all of that is covered by the state.
Question about, do all residents and staff have to agree to be tested for a facility to get testing? No. So we understand that there may be some residents or maybe even some staff people that would decline testing. Again, this is voluntary. You do not have to have 100% participation in order to take advantage of the testing assistance that Liz discussed. When doing facility testing for staff, do the results go to the staff person or the facility? So the answer to that is likely both. So what we're trying to encourage is that the medical director for the facility themselves be the ordering provider for the testing. If that's not possible for whatever reason, we can work with the facility to arrange that through a different route, but the best option is for the medical director of the facility to be the ordering provider, and then in those cases, the results would come back to the facility to share with their staff members because, again, that individual would be the healthcare provider, ordering healthcare provider on record. Have there been any discussions about how long long-term care facilities should prohibit visitors? And I know that this is has a huge impact on patients and families, residents and families, and we certainly understand that this is a big ask. From our perspective at the state level, I have not seen any perspectives on how long or when recommendations would be lifted. As you know, CMS plays a role in these recommendations as well. Liz, do you have any updates on that?
Same as you. I think that we just continue to monitor for updated guidance, especially from our federal partners.
Okay. So a question about a 14-day quarantine applicable for staff that may travel for vacation. And so that's a great question. And so we have clarified this. And we are no longer recommending that people who travel outside of Iowa but still within the U.S. Complete a 14-day isolation or quarantine. Again, that was in place previously, but because the virus is widespread in Iowa and really across the U.S., we are no longer requiring that isolation period because, again, people could be just as possibly exposed in their Iowa communities. What is still in place is the CDC is still recommending that people who travel internationally isolate for 14 days. We have a resident who's refusing symptom monitoring for COVID-19 and just asking for some considerations there. Why don't we follow up with you directly on that question? I think that's probably a case-by-case type of situation that we would work through with you. I see a couple of questions just related to Test Iowa. Again, there is a call center available for questions related to Test Iowa, and we would encourage you to call them if you have questions about when you receive results and those types of things. Okay, so I think hospitals caring is our recommendation for hospital staff caring for all patients, not just COVID, to wear eye protection. Yes, we would recommend that persons providing patient care wear eye protection and a face mask. All right, that is all the questions that we have at this time. Certainly we appreciate everything. We've got a couple more pop-ins, so hold on a second. I spoke too soon. A question about would our medical director order COVID testing for both staff and residents? Yes, that's the cleanest way to do that. And so if the medical director is willing to order that testing for both residents and staff, then that's a straightforward way to do it, and the results come back to the facility. All right, well, thank you all for your time today. We appreciate it in the interest of making sure that we're using your time wisely. I'm not seeing anything else pop as of right now, so Certainly, if you have questions in the interim, don't hesitate to reach out to us or to your local public health partners, and we certainly appreciate everything that you're doing. So have a good afternoon.